All right. I'd like to thank everybody to coming to our first town hall. I'd like to start off with a moment of silence for the workers we've lost and the loved ones we've lost to this pandemic. Thank you. Before we get into the presentation, I was thinking of a quote by Mother Jones that we need to mourn the dead, but fight like hell for the living. And so, you know, we're having a kind of a Gettysburg moment here as a country. We lost more people than the Vietnam War to this pandemic in just a few short months. And that's made us need to pause and reflect about, you know, where our nation's going. This pandemic has shown us, you know, besides the need for organized labor in almost every sector of our workforce, that we need to keep our workplaces safe. We need to keep them safe now for our frontline heroes, for our frontline essential workers. We need to keep them safe for when everybody else starts to go back to work. We need testing so we can make sure that our workplaces are safe. We need to have inspectors to make sure that our workplaces are safe. And that means you know, government employees going out and inspecting the workforce. And we need to, most importantly, make sure workers have a voice in the workplace. And so I look forward to our hearing the proud work that our frontline workers are doing, hearing firsthand from the folks, you know, on the ground about, you know, whether they signed up or not, they're risking their lives to keep us safe. I'm looking forward to the proud work they're doing. And most importantly, I'm looking forward to hearing what we can do as a labor community to maybe help these folks and our elected officials, you know, what we can do to, you know, make our workplaces safer, as, you know, we hear from these frontline heroes. So with that, I'm going to pass the virtual mic over to Donna Goodman. Donna, you're muted.
Richard, you're before me.
Oh yeah, Richard first.
Hi everybody, my name is Richard Burton and I'm here to just give a quick little historical inspirational story about May Day. We are in fact having this event on May Day, not by coincidence, but because May Day has such great resonance in our country's history. Unfortunately, the day is not something that a lot of US workers are familiar with. People think of Labor Day as sometime in December, but internationally, May Day is the International Workers' Day. And it's especially important to just remember that in 1886, a nationwide strike consisting of 350,000 people took place, all in support of what was then a very bold proposals not that different from the things that Sparrow was just articulating. In the case of 1886, this was a strike for an 8-hour day. And it resulted in ultimately some victories in that regard, although there were also a lot of losses and some violence that was undertaken on behalf of the bosses as usual. I should just point out too that the Labor Day that we come to think of in the United States came about as a result of another strike that happened in 1894. And the railway workers at that time went on strike, and the then President Grover Cleveland, in an effort to kind of get them quiet, created a different Labor Day just to kind of have them feel pacified. So that's our labor history here briefly, but let's celebrate the spirit and courage and boldness of those prior workers and see if we can channel some of that here today and from now on. Thank you.
Hi, everyone. Thank you for joining us. My name is Donna Goodman. I'm a member of United University Professions at SUNY, that's UUP, and we're the faculty union at SUNY New Paltz. This evening, Hudson Valley Labor celebrates May Day as part of an upsurge in labor activism in our region, across the nation, and around the world. This virtual town hall is the Hudson Valley ALF's launch of a series of worker rights panels that will explore a range of issues that are critical to the labor movement, both unionized and not yet unionized. The COVID-19 pandemic brought to the surface deep inequalities within our economic system. This evening, we'll hear from frontline workers whose jobs are critical to the survival of the rest of us, and yet they're not getting the pay, the benefits, the respect, the control over their jobs that every worker needs. This crisis, some might call it disaster capitalism, an opportunity for people to take even worse advantage of workers than they've been doing heretofore. The crisis has thrown into sharp relief the necessity for workers to stand together, to demand their rights to safe working conditions, economic justice through pay that recognizes the true value of their labor, and a place at the table in making decisions that impact our lives and our families. Our speakers work in healthcare, in food production and distribution, and in emergency response. After their talks, you'll have an opportunity to ask questions using the Q&A link or the chat link. It might be different whether you're on Facebook or Zoom on your screen. And then 3 of our esteemed elected officials, federal, state, and county, will respond to our concerns. What solidarity and resources can their offices bring to our struggle for worker justice? And just one more thing, we're told there's not enough money in our state and federal coffers to pay for essential work to be done. Actually, there is money, and we know where it is. New York State is the home of Wall Street. America is the home of more than 500 billionaires, including the head of Amazon, which pays no taxes and refuses to hire our neighbors in Teamsters Local 445, who were out there supporting this morning on the highway. We live in a country that could pay all of its laid off private sector workers 100% compensation. And that amount would come to just 1/3 of our budget for wars. So let's use this May Day to re-energize the unions in the Hudson Valley and beyond, and to reconnect through our common interests in the labor movement. Let's reimagine a world of worker and social justice in the wake of the coronavirus. Our first speaker this evening is Greg Pasquale of the Food and Commercial Workers Union, Local 1500. Thanks.
Hello, everybody. I hope everyone's safe, taking care of our families and doing whatever we need to do just to be real cautious out there with everything that's going on. Special thank you to all the frontline workers, all of our medical people, our nurses, everybody out there that's dealing with this. So a little bit about me. I am the union delegate for UFCW Local 1500. Our union goes as far north as Rhinebeck, New York, handling the tops in Rhinebeck. We go into Manhattan all the way out to the end of Long Island. My area is from Rhinebeck to Dobbs Ferry, so I am handling Dutchess County, northern Westchester, and Putnam. So when I was thinking about what I wanted to address tonight, I was looking back at, we've had, I believe, 7 weeks now of this craziness and how everything has changed, what our need as a union was 7 weeks ago, what it has come to now, and things that should be addressed. The workers in the store, I cover 2,200 members in 19 stores. So I have a very good feel dealing with all 3 counties of what's going on here. So let me start with the latest issue that we're having in the stores. Last week, when the mask mandate came out, this all of a sudden turned into a very serious situation in a lot of our grocery stores. It came down to, we've had customer fights in the store, in the parking lot, people trying to address other people with wearing masks. We've had customers go after our members in the stores. This has become our #1 concern. We've stressed to these companies that we have to get security in these buildings, especially in the parking lot. Some companies are taking advantage of this, are addressing it, and they are putting security on the sidewalks, monitoring how many people come into the building. They're monitoring if you're wearing a mask. They will address it. They will not let you in the building if you're not wearing a mask. So that is the concern, the latest concern. We've dealt with all of the issues as far as PPE in the stores. We've done as far as hand sanitizers, gallons of hand sanitizers that we've secured through some of our electeds that have a very good connection with Governor Cuomo, who did supply us with a lot of hand sanitizer that was delivered to the stores through us. Masks, anything that we could get our hands on, we're delivering to the stores. The stores have, I have to say, the companies that we have under our jurisdiction have done the right thing. They have pushed, if they needed masks, they know they can call on us. If they need hand sanitizer, we have more. But our job is to just go around and really make sure that these people have it in the building, and not that we're just hearing anything that, oh yeah, the companies, we're not quite taking the company's word for it. Let's put it that way. So with this being said, some companies were very quick to react as far as plexiglass, putting the plexiglass up on the registers. Some companies were a little slower to react. We pushed them as hard as we could. It was great having plexiglass at the register, but what about the service desk? What about the pharmacies? What about the shop from home departments? And these were some of the little things that a couple of weeks ago, that was an issue that we did address. One of the things now that I'm finding, and I know I'm bouncing all over the place here with the 7 weeks, but the stress issue in the stores now has become a serious, serious issue with 7 weeks of this. With the, a lot of people, just the not being sure in the store, going to work every day is stressful enough, but now with the customer issues on top of that, it's putting people over the top. The companies have been great with the COVID pay, no issues as far as letting people go out, no issues whatsoever. The COVID pay is great, but now we're starting to rename it as fair COVID pay. The COVID pay was great when it started, but we might have to adjust a little bit, and that's our next concern that we're going to go and address with some of our elected officials. So, the guidelines that the state and the federal government have put out, the companies have been very good with it. I have no issues there. Our concern is, are our members being allowed anything that they might need from the companies? We're getting no stress, nothing back from the companies. As far as a couple of weeks ago when it was masks, were they mandated, were they not mandated? No issues from our companies. I know I'm kind of jumping all over, but the main thing that this union is after is, are the companies following all the guidelines, all the procedures that they have to in the stores? And it's so far been very good. Back to the customers, that's our number one concern right now. Customers in the stores, with violent customers. And I'm not afraid to say it. I've seen fights, and we're not talking about down in Westchester. We're talking about in Beekman, New York. With fights where the police had to be called because customers are brawling in the parking lot. That's an issue. So that's our concern right now, the mask issue with the customers and the way the customers are treating our members in the stores. So that's about all I have. I know I'm all over the place, but, any questions, I'm here.
Okay, thank you, Greg. We'll have all the questions at the end. Thanks so much.
Okay.
Next is Kathy Rodriguez of CSEA. Kathy?
Hi, my name is Kathy Rodriguez, and I am a public safety dispatcher at Orange County 911. I represent approximately 1,400 members of people that work for Orange County. It's been rather strange for all of us that work for Orange County. We have many workers that have been deemed essential that have never been essential before, such as our social service staff and our public workers, because they're desperately dealing with many desperate people that need public assistance. They need SNAP, which is food stamps, and they need help to fill the gap from their lost income from COVID. Our DPW workers have been cleaning work sites to make them safe for the rest of us that have to work there, maintaining our landfills, sewer plant, and highways. Our non-essential staff, some of them have been relocated to areas such as working in the call center for when people call for assistance and help them. Our health department, they do a lot of work with very few people. What I do is I take phone calls from the public 24 hours a day, 7 days a week, 365 days a year, whether it's sunny, whether it's snowy, or whether we're in virus conditions. What happens is people get very, very upset. In Orange County, we have approximately 340,000 people. When 340,000 people don't know who to turn, a lot of times they call 911. Unfortunately, we don't know which call is an emergency call or a non-emergency call till we answer the call. So we will answer the call, we will get information from them, which sometimes they're not the most forthcoming with information. And a lot of times, because Orange County is so big, it's over 800 square miles, people don't know where they are. If you have a car accident and you're on Highway 17 or Interstate 84, there's mile markers on the side of the road and you can tell me where you're at. And with using the technology from your cell phone, we can usually figure out where you are. If you're in the city of Newburgh and you dial 911, and you don't know where you are, it's a lot harder to find you using the GPS graph information and technology. So we need to know where you are so we can send you the help. In Orange County, we dispatch all the fire companies, police agencies, and ambulances, as well as highway department trucks from the county. And we also, unfortunately, do all the medical examiner calls, which we've lost over 300 people to this terrible disease, in addition to our regular people that just pass away. So it gets to be very depressing, and it's not always a fun job, for lack of better things to say. Why is our job, what I do, important? Well, if I wasn't there, or one of my coworkers, and you called for help and no one answered the phone, what would happen? You wouldn't get your ambulance, your house would burn down, you'd have an accident, people could be killed, and they wouldn't get the help that they needed. So it's very important that when we speak to the caller, we get the proper information and we send the correct resources. In Orange County, we have a resource problem. Just like many other communities across the United States, we don't have the volunteers that we used to have. The fire departments and the ambulance corps are understaffed. Sometimes they have great difficulty getting a crew together so they can go to their emergency. So then we have to go to mutual aid, which means you get another agency to come and help. It makes for a very, very difficult job of getting help there in a timely manner sometimes. What am I proud of? The countless people that are helped by the services that we provide. We are considered to be the first responders. Sometimes the 911 dispatcher is the only contact you'll ever have with any emergency services in your entire life, if you're lucky. If you're not as lucky, you will get to meet the fire department or the police officers or the ambulance people. But what I'm proud of is everything starts with us. When you call, it's our job to get the info. It's our job to maintain the phone line with you to try to get more information for our responders, such as if it's a domestic situation, is there a weapon involved? We're responsible for the responders' safety as well. So it's a lot of work. It's a lot of things that you're doing simultaneously, And you definitely have to be a multitask person. A person off the street, if you put them in that chair, they wouldn't last very long, because you have to really be able to do a lot of things. And quite a few of them we have to have different trainings on and we're certified in, such as CPR, that type of thing. What do I need to be able to do my work and to live my life? Well, we need support from the community. We need enough skilled people to fill the jobs. We have a very difficult time being fully staffed. We hire people. They go, first of all, to get the job, you have to take a civil service test. Then you're going to go and you'll get hired. You'll get trained for 6 weeks through various programs and things we do. And then you'll come out on the floor and you'll be trained by a trainer so that you're never alone. It's a very, very long and extensive training people. And unfortunately, some people don't make it out of the training. It's a very tough and demanding job, and it's really, really stressful. Many of our calls are brutal, and you have to use our training every day to be able to keep the caller calm, to keep the caller safe, and to tell them the right thing to do. Things just as simple as, if your house is on fire, to get everybody outside. People forget to do that. You'd be surprised. They want to stand there and they want to tell you what's going on, but they need to leave the house. We don't want them to get hurt. And if they close the door behind them, it's going to give the fire company more time to fight the fire, and maybe we won't lose the entire house. What problems are we facing? Trying to find good people who can do the jobs, and some other things like the lack of mile markers on state roadways. If you're driving down, I'm going to use a state highway as an example. Say you're on State Route 211. State Route 211 runs from the town of Deer Park and it runs into Montgomery. There's no consistent street numbers. Each town has their own set of street numbers. When you get to a certain point, then it turns into, the name of the road changes to whether it's 211 East or 211 West. That's whether it's east of the city of Middletown or west of the city of Middletown. Then you go through the town of Walk Hill and you get into Montgomery. If we had mile markers that make sense on the side of the roadway, if someone has an accident, they would be able to say, I'm by mile 22, and we would know right where they are and whose jurisdiction it is. What we do on a day-to-day basis is we make Orange County work. We don't get a lot of credit for being the first responders, and when we have the ask to the elected officials, I'll explain that a little more, but that's what I do for a living, and I love my job. Thank you.
Thank you very much, Kathy. Please welcome Karen Barrett of 1199. Karen, do I see you?
Good afternoon, labor leaders and my fellow comrades. It is a pleasure to be on this panel tonight. I represent 1199 members from Yonkers all the way up to into Westchester, Rockland, Putnam, Dutchess, Orange, Catskills, and I go over to Port Jervis. And then I switch over on the other side of the river and go into Ulster County into Kingston. Our members are on the front line and they're dealing with, first our issue is the PPE and getting the right equipment and getting these PPE for members to protect themselves. Now they are living the reality of COVID and seeing their coworkers coming down with the virus and seeing some of them being incubated. They have to do these procedures on their own members, their own coworkers, and it's heartbreaking. Some have recovered, and we give God thanks for that. Some are still fighting the battle. It's really a challenge when we are trying to fight a crisis and where they don't see no end to this crisis. And I must give credit to some of the employers. They have worked wonderfully with us trying to navigate through this process, which is unprecedented that we are seeing. And they have worked tremendously alongside to make sure everything runs smoothly. However, there is nothing that is going to happen smoothly when it comes down to a crisis that nobody deals with. And we still have issues that we're working out when it comes on to our members being tested positive, and they have done the quarantine. Now they get returned back to work and they're coming up back positive again. And now management is saying, I can't pay for a next series of them being out because now I don't know how long they're going to be out, and we want them to utilize their time that they have in the bank in order to be paid. And these are no fault of these workers, and the workers are saying, no, we can't touch our time because we don't know how long this crisis is going to last. And by the time we get done, our banks will be depleted. So we are still facing that uphill battle. What do we do with the members who they go out, they do their quarantine time, they're back in the workforce, and now they're coming up back positive again? So that's a big challenge. The other challenge is on the mental health side of it, where our workers are calling, telling us that they're having nightmares, they can't sleep. They have seen so many people pass away in front of them that it's taking a toll on them mentally, emotionally, and physically. It's also taking a toll with them, with their family and their loved ones, because they're constantly out there on the battlefield, and they're worried that they don't want to go home to their houses to bring this home to their families. So it's like a double whammy for them. They want to help. They're in the field to help people. They chose that profession, but then who is there to help them go through this crisis? Because they're torn in the sense that they're on the job and this is happening in front of them, and behind the closed door, they're breaking down. The challenges that we have, that we foresee moving forward, is that based on the budget, and this is where I call on our elected officials for help, because they're waiting out to see what the stimulus package is, and they are not willing to entertain the hazard pay that we are pushing for all healthcare workers. They want to divide the members in the sense that they want to choose who is essential from who is not essential. And I must give credit to my members, because if one thing I can tell you that has brought around, that the members are sticking up for each other inside their facility. So management will say, okay, we'll offer bonus bucks for the folks who are working in the crisis, but they forgot the housekeepers who are coming in to clean those rooms. They are still our members. They're still facing that crisis, but they look on the staff like the respiratory therapists, they'll give titles out. The respiratory therapists deserve this. The nurses deserve this. And they pick and choose titles. And the titles are pushing back and saying, no, all of our members deserve to be compensated. It's not, I can't operate without the housekeeper. If he doesn't come in and sterilize and clean this room, guess what? All of us are contaminated inside here. So everybody deserves crisis pay. And that's the fight we're pushing currently right now in the Hudson Valley area. Our members are fighting. So far, we have not negotiated with any hospital who is willing. They're not saying they're not willing to entertain it, but they're not willing. They're waiting because they're either waiting to see what the stimulus package is going to be. And we know that they have already gotten some of the packages. And this is what we are saying to them. We know that you have gotten some of the funding already. Use that funding and give our members some relief. Our members did a campaign the other day to one of the employers, and they wrote them emails of their personal stories around this COVID crisis. One of our respiratory therapists, he wrote a letter to his CEO. It brings tears to his CEO face, because he said it's not about the money for him. It's about just appreciating the work that they do, and they shouldn't even have to be asking for this crisis pay. This is something that they should have already considered doing for them, just as an appreciation for what the work that they're doing. So it's a real struggle, and we are in a fight right now to get this crisis pay. How long this is gonna last, nobody knows. And with in Kingston, I'm faced with a shop that we just newly organized, and they don't even have a contract. But those workers are willing to fight, and we're willing to help them fight. And they are worried that because they don't have a contract, are they protected? What are their rights under the LRB to do this, to take on this fight? Because they're really fighting a monster who doesn't care about them. They just care about revenue and publicity right now. Nobody wants to be out there in the spotlight. Nobody wants a demonstration in front of their hospital say they're not doing the right thing. But then they want it on the hush-hush on the inside, and the workers must just work as if it's nothing and just go through the motion. And, you know, the workers are saying, no, enough is enough. We need to be recognized. You're saying we are heroes, we are champions. Treat us that way. Don't just say it on the inside, but show us. That's what I have. Thank you.
Thank you. Thank you so much, Karen. Jeanette from PEF. Jeanette Clark?
Yes, can you hear me?
Yep.
Okay. First off, I'm extremely humbled to follow my brothers and sisters who just spoke. I represent PEF in the Hudson Valley, and we represent the second largest state public union of 54,000 members of all the professional, scientific, and technical workers in New York State. We are on the front line, and many people don't know about us as public servants because it's very difficult for us to be out in that forefront. People don't realize with us that we, like Kathy said, how her CSCA makes Orange County work, PEF makes New York State work. From our Department of Labor workers, when people are laid off and they're calling for unemployment, or there are public health complaints, PESH complaints from public workers, that they work very hard on those issues. To our IT people, who are kind of the unspoken workers across the state of New York right now, making sure that we have technology working so those that are telecommuting and cannot are working. From our nurses, and I can't say enough about our PEF nurses. We have PEF nurses in hospitals, SUNY downstate, SUNY upstate. We have nurses across the board in our Department of Corrections, and in all of what we call our O agencies, OMH, OPW, I'm sorry, I should say what those are, Office of Mental Health, Office of People with Disabilities, and Office of Family and Children's Services. Please, let's not forget our kids that have been put into facilities that our PEF workers every day are now working, and they are very torn and lost with everything going on. We also represent, which a lot of people do not realize, Homeland Security, and also the New York State Fire. So what does that all mean? It means that behind the scenes, our state workers are setting up everything you've all talked about. Your DOH guidelines, Department of Health. Those guidelines you're receiving, not from the CDC of the federal government, but the DOH guidelines are written often by our PEF members who are working in DOH. The first testing unit in New York State that has also completed the first swab test of saliva, not swab, but saliva, is Wadsworth. That research center and that testing scientific agency is all PEF members. But what does this all boil down to? It boils down to that we're all in this together, one, and that without each of us doing our part, not just PEF, but CSCA, SEIU, and all the other affiliates that are going to be speaking, without all of us doing our part, New York would not work. My heart pangs. We've lost members. Obviously, we have doctors in these hospitals. We have nurses in these hospitals. We have OT, PT, and every other clinician. So we are seeing and receiving calls daily. We're also receiving calls on the simple things that people don't realize. What do I do if I get sick? How am I going to get paid? Do I get paid? Where do I turn to? So I'm extremely proud of what PEF has done. I would like to acknowledge our president of PEF. He has worked very strongly with the AFL-CIO as a component of the AFL-CIO, right down to the subways needed to be cleaned. And PEF took a stance on that because our frontline workers have to ride those subways every day into those hospitals in Queens, Brooklyn, Staten Island, Long Island, and vice versa. So that was a huge issue. I also would like to thank our local leaders. I've got Dan McCormick from the Department of Labor. I couldn't ask for a better colleague to work with, and he's seeing it with the unemployment calls. We have been inundated. But what the governor has done, we're already at bare bones. PEF is already at bare bones of staffing, and what is being proposed is very frightening to us. If there's a layoff or a furlough, where I ask for my colleagues to stand with us in PEF as a public sector union, is that we already are at minimum staffing. And without us providing those services, it's very difficult for New York State to run. I would also like to talk a little bit about the New York State budget. As we all know, it is going to be a quagmire, and that alone is going to impact us across the board. Our Medicaid revenues for the OPWDD and O agencies is going to be a significant diminishment of possible services. So what do? I have worked for OPWDD for 38 years. I work in the trenches as a social worker. I work with the most vulnerable population when we're talking about those that have been dying in hospitals. I also service those that are in group homes. And we are seeing our individuals pass away due to this COVID-19. And I want to say very clearly, usually I'm a very upbeat union leader. Most of you know I'm the one at the union rallies, giving the big shout outs and doing all those things. But right now, my thoughts and prayers are with everyone who has suffered through this unprecedented crisis. And we thank you. And we are asking that you support us public workers so that we can continue to make New York State run. Thank you.
Thank you, Jeanette. Our next speaker is Jackie Rutchick of New York State Nurses Association.
Hey everyone, thanks for meeting today. It's really encouraging to know there's so many of us who are fighting to protect essential workers during this time. I'm a registered nurse. I work at Health Alliance Hospital in Kingston. I was born and raised in Dutchess County. I went to Dutchess Community College and got my degree in 2016. And I live over here in Kingston now. I am on our local bargaining unit's executive committee. I'm the vice president, and I work alongside about 400 nurses in our union here. I work on the COVID-19 medical floor, so I've been certainly seeing some things firsthand that are disturbing and are definitely affecting me spiritually, mentally, emotionally. There's definitely some things that are still true that we need from 2 months ago. First, I do want to say what I'm proud of, and that's all my union nurses and all the coworkers in healthcare that have been stepping up, taking care of patients during this crisis and doing it without the proper protections. We're risking our lives because we truly care about our patients, but it shouldn't be that way. Like I said, this crisis is taking not just a physical toll, but a mental and emotional toll on us, especially as we realize that our employers and our government aren't doing as much as they can to protect us. So the challenges, like I said, they're the same that they were 2 months ago. We don't have enough personal protective equipment to do our jobs. So hospital administrators, they'll tell you that it's adequate, but if you ask me, if you ask any of my coworkers, we'll tell you the truth. And it's just not enough. It won't be enough until we return to science-based guidelines for safe use of PPE instead of dangerous conservation guidelines that are based on supply chain issues. Right now, we're having pressure to restart elective surgeries as early as next week. and pressure to reopen the state at large. But there's so many actions at every level of government that need to be accomplished before we can safely do that. So Congressman Maloney, you have influence at the federal state level, and that's where we need the next stimulus bill to provide significant funding to New York State. We are the global epicenter for this disease. Our state alone has more cases than the entire country of Spain. So yeah, we need that federal funding. And we also need that bill to include protections for frontline workers, like paid sick leave, worker compensation, OSHA protections. Because for essential workers, this is an occupational hazard. It's an occupational disease. So the war is not going to end if we don't fund and protect those that are battling it head on. And at the state level, Senator Metzger, we need you to stand with essential workers who are rejecting state budget cuts to fundamental services like healthcare and education, because nurses especially know the consequences of those types of cuts to our communities. And that leads me to another point of consideration, that nurses need to have a big say in how and when we reopen, because we put public health and safety first. And our voices are going to be the ones that truly protect our community and help us stay out of this crisis when we do finally win and not have another resurgence. And at the county level, Executive Ryan, I have something a little more specific to ask of you, and to ask for your support in the return of mental health and detox services to Health Alliance Hospital. Because we have Ulster County patients having to travel to Poughkeepsie now for these services ever since Mary's Avenue was closed down by the state. And that's creating a barrier to care that shouldn't exist, especially in this time when we're all facing unprecedented stress. We have to have these services to support our community, not just medically, but mentally and emotionally as well. I know that all three of you have really been working so hard, and I truly appreciate your service. I do have faith that you'll continue to fight for us, just as I'm always going to fight for my patients and my coworkers. And I just want to thank everyone on this call for your service and all of your various unions, and to just keep up the good fight.
Thank you so much, Jackie. Our last speaker in terms of union speakers will be Carlos Orellana of UFCW. Carlos?
Hey, thanks. I like how you pronounce my last name. I like it.
We practiced.
So I'm Carlos Orellana. I'm an international organizer with United Food and Commercial Workers Union. I have been assigned to be the lead organizer for the Farm Workers Campaign in the state of New York. And I would like to say thank you to all of you who have been supporters of the Farm Workers Campaign throughout the years. You know, without your support, this would not be happening these days. As many of you know, now farm workers have the right to unionize and to organize in the state of New York. And this is thanks to many, many people, union leaders, politicians, religious leaders, college students, community organizations. We got support from many people across the state. So in the last few weeks, together with the Rural and Migrant Ministry, we have been distributing masks and some other, food and other assistance to many farm workers throughout the state, from Long Island all the way up to Western New York. People have been sending masks to the Rural Migrant Ministry and financial support, and we have been trying to get that help to as many workers as possible. Many groups have been involved: Cornell University, the Workers' Right Law Center in Kingston. There are other groups, worker centers in Utica, in Rochester, Buffalo, that have been helping. If I can ask one thing from you, supporters, is to go to the Rural Migrant Ministry website. And if you could help with a mask or any financial donation, it would be greatly appreciated. Again, it's the Rural and Migrant Ministry website. Anything you can help with will be helpful. We know that after May 15th, after people go back to work, still it will be very challenging for all of us to keep, ourselves not positive and avoiding getting infected. And so will be many workers on the front line. Masks will continue to be needed, I think for the rest of the year. So there will always be a need for masks. I'm really happy and I appreciate all the help that different groups have been given and providing to farm workers throughout the state. I'm only just one person, but there is a lot of people who have been involved in helping them. I would like to say also that since the 90s, when the Rural Migrant Ministry got involved in helping and organizing farm workers, it was a dream. We never thought that one day the farm workers in New York State will be able to unionize and to get organized. And last year, Governor Cuomo signed the new law that farm workers can be now unionized. So I was just starting to organize at the beginning of the year, and then I found myself having to face this pandemic. So what I would like to say is the farm workers are some of the most excluded and marginalized workers, not only in New York State, but across the country and around the world. Many of them live and work with the same employer. So if they lose their work, they also lose their housing. If they get infected, they go, to be on quarantine and share the house with 5, 10 other coworkers. So they have been more exposed than anybody else. They don't have any benefits, have to pay sick days or personal days. So if they don't work, they don't make any money. So there have been a couple of, at least 2 people who passed away from workers from Guatemala. It is so difficult to, send people back home for them to be buried by their loved ones. And this is just the beginning. We don't know how many more people will pass away or die and how difficult it's going to be for their relatives to really, show them their loves. But anyway, I just want to thank you, all of you, for your support to the struggle of the farm workers. This is just the beginning of the organizing campaign. And, it's going to take a lot of efforts and a lot of support from many of you. And again, if you can go to the website of the Rural and Migrant Ministry and help in whatever you can, it will be greatly appreciated. Thank you.
Thank you so much, Carlos, and thank you to all the speakers. I'm now going to turn it over to Beth Wilson, and she will moderate the Q&A.
Okay, good evening, everybody. I'm Beth Wilson. I'm the chapter president for UUP at SUNY New Paltz. So, and as Donna mentioned before, we're in the same union. We represent the faculty and staff at the 4-year SUNY colleges across the state. It's my absolute honor to sit and help moderate with this panel, having heard from all of our terrific frontline workers here. So in terms of the Q&A, what I'm going to do, I've got a couple of really good questions that came up in the Q&A box in Zoom. If anybody else has other questions, I encourage you to please post them in there, because that'll give me a chance to kind of work them through. And if I would be very happy to get the people who submitted the questions. First one I got on my list is by Naomi Allen. So I'm going to click on a thing here that's supposed to allow Naomi to talk. Naomi, are you with us?
Yes.
Yes. Do you want to ask your question, and then we'll see what kind of responses the panelists are going to have for this?
Well, we see the federal government and to some extent the state government taking advantage of the pandemic emergency to tighten up things on behalf of landlords, on behalf of business owners, and on behalf of people who are already privileged. And I'm wondering if there could be some discussion of what we can do, what the labor movement can do to see that when the pandemic is over, or even when it's not over, even as it goes on, as it stretches on, we can take advantage of these emergency situations to try to improve conditions for working people, to improve rights and health and safety and so on, so that working people are not put at even more of a disadvantage by the pandemic.
Okay, so those of you who are panelists, I think you can just unmute yourselves if you'd like to address this. We're open to anybody who wants to chime in.
Listen, I'll take a shot at that. Can you hear me? Good evening, everybody. Hi, it's Sean Maloney. Listen, first of all, let me just say thank you to Hudson Valley AFL. We've done several of these with Sparrow in the last week or two. It's great hearing from people on the front lines. I just want to, first of all, happy May Day, everybody. And I want to lift up all the stories that you all just told. I mean, that's a lot of stuff. And Karen, I mean, what your folks been doing, 1199, SCIU, God bless you guys, but all of you, I mean, you know, it's very helpful for us to hear it, number one, so thank you. On the question you asked, Naomi, you know, I think one of the things that has happened here, hopefully, is that people have seen that it's working people that make this whole thing run. I mean, we're talking about healthcare frontline workers. We're talking about teachers who are still teaching like classes, even though they're in 25 different bedrooms and kitchens. We're talking about people who are picking up the garbage, going to work no matter what. The mail carriers. I mean, the folks who aren't paid very well in this country, those workers in food processing plants, farm workers. I mean, the people who, ironically, you know, the people who we compensate the least, who somehow are the most important when everything goes wrong. So it has opened a lot of eyes. I think passing paid family leave on the federal level for the first time as part of the Families First bill is a really important stake in the ground. So in terms of what you're talking about, how are we going to prove out some things right now because we know we need them? That's a good example of that. I've got a bill to pay healthcare workers more this year. So talk is cheap. We all say thank you, but I've got a bill that will give $7,500 in tax credit to everybody making under $100,000. That will also treat essential workers' pay as tax-free for the entire duration of the national health emergency. I mean, things that will compensate people. Compensation fund for people who are hurt or whose families are hurt as a result of the pandemic, along the lines of the stuff we did after 9/11 for first responders under Zadroga. There are real tangible things we can do around OSHA protections, around PPE in the workplace, around making sure that workers are at the table and have a voice in how things are reopened and when we go back to work and what safe means, making sure we build into the benefits that people are getting in large industries, worker protections, and the kinds of things that should have been there all along. If we, the taxpayers, are going to bail anybody out, we got a say in how it works. I mean, I think those are some examples. I won't go on and on, but those are some examples of how we can really do some good in the midst of this terrible tragedy. But thank you all for your stories and for your service and what you're doing. It's great to hear, and it means a lot. So God bless you guys.
Okay, thanks for that, Sean. Actually, if I could say like two words of response, a couple of words anyway, in response to Naomi. I think, yeah, as I told you in the Q&A box, what a terrific question about improving conditions, working conditions. And I think here on May Day, it's really important for us to be thinking in terms of absolutely our frontline workers that we're highlighting in this panel, but ultimately all workers. I mean, you know, nobody thought farm workers were frontline workers until this hit. Nobody thought grocery store clerks were frontline workers until this thing hit. So if we're going to kind of pick and choose about who's important, I mean, all of our labor is important. And I think it's important for us as the labor movement to stand up and demand, you know, I mean, if we're going to get paid sick days, it shouldn't be paid sick days just for people who are considered in a certain class. It should be for all workers. If, I mean, I would be really happy if we could consider, you know, basically everybody who's working class essentially in this country and living paycheck to paycheck. You want to consider us, you know, we shouldn't be paying taxes because there's plenty of people with a lot more money than us that should be paying the taxes. So a worker response to this, and you don't need to respond to me, Sean. I'm just kind of venting a little bit.
No, but Beth, the paid family leave provisions do apply to everybody. That's an important thing that on the federal level has happened for the first time. So just, and by the way, you know, props to Jen Metzger and folks in the state level who have been fighting for that and want it on the state level, all of you. I mean, but there is some, some of this going on here that's worth talking about.
The more universal things are, the better they are for everybody, because then it's harder to take them away once we have them.
Can I weigh in? This is Jeanette. I'm sorry to weigh in, and Sean, I'm so appreciative. Hi, SPM, as I always say to you. I'm so appreciative. I know, you know, I'm very appreciative for the federal. But just so that you're aware, on the extended FMLA, which included the child care component, New York state agencies have the opportunity to opt out. So we are seeing that as public workers for our families that are single parents and COVID positive or essential frontline and the kids are home, that actually with the EFMLA from the federal government, which is the first 2 weeks you use your accruals, next 10 weeks, you know, the federal government assists. That is, the New York state agencies have the opportunity to opt out of that program, and they are, some of them.
Yeah, and I mean, I do know the New York State program that was passed for paid family leave only extended to private employers. One of my proudest moments was being on the negotiations team for our last UUP contract, where we negotiated into the paid family leave with the state, the first state, you know, like public sector union to negotiate into it. But again, it's in fits and starts, as Jeanette is indicating here. Okay, so we had Rob Pinto had another good question. Wait, if I can find Rob in the chat. Yeah, hi Rob, are you with us?
Hey, how are you?
I'm fine. How you doing?
Hey, I have a question about the New York State budget. So obviously we have there's a giant deficit and growing in New York State. How is this going to affect our essential worker jobs, PEF jobs, CSEA jobs? How's it going to affect schools, teachers? And what revenues generating ideas do you guys have that can potentially curb the devastation that is going to be done by this?
Okay, thanks for that, Rob. Yeah, if we could hear actually from some of the union representatives, if you've got things that you've been seeing in your units so far as far as impacts are coming. Let's start with that first.
I can speak for PEF. We have already a hiring freeze was announced, possible furloughs, and across the board 10% cuts of all of our agencies, and our agencies already were at bare bones. So I emotionally am very torn on this, because the very things we hear people talk about, workers' comp, unemployment services, frontline healthcare workers. So we are facing currently, it was announced yesterday, a hiring freeze and a 10% across all of our agencies.
Okay. Jeanette, did I hear also that they were delaying some negotiated pay increases for CSEA? Is that a thing that happened, Jeanette?
I can answer a little of that.
Pat, yeah, I'm sorry. I'm sorry,
it's okay. What the state did was our CSEA members were supposed to get a 2% raise on April 1st, and they decided not to give it to them. They told them that they could have it in 60 days. Now,
I wouldn't say they.
Well, I'm sorry, the governor. And what happens is these people were counting on that money. You know, they negotiated it in good faith. The governor got a raise. Some of his people got raises. Did they not get theirs on that date? That's what our people want to know.
And on behalf of the PEF members, and even though we're public servants, our members don't go to work for New York State to make money. Many of us entered the system when the benefits were better until Tier 6 came about, when retirement obviously was gutted for our public sector. But PEF is without a contract currently. We have not received even a 2% raise now going on 2 years as of March 31st of this year.
Yeah, I know that within UUP, we've got some, our 2% are due coming up on July 1st and September 1st, depending on what kind of job you have in our system. And I'm not entirely sure where that's going to be going. I mean, I did just this week find out that there's a state subsidy payment to the campuses that normally goes out the end of March, beginning of April, and that has not been released to the campuses yet because they bumped tax day for the state, and apparently there's some kind of cash flow thing with the state. This is, it's not, it's looking kind of bad now, but yeah. Oh, Jen, were you going to say something?
Yeah. So if I could chime in. First of all, I just want to thank all of our frontline workers today for sharing the incredible, first of all, the strain you're under. And I think one aspect that really kept coming across was the stress and the mental health tolls that this is taking on our workforce, and the lack of adequate support for our workers. And it's not just right now, it's beyond this crisis. I mean, we have this natural instinct to, kind of tamp it down while we're in crisis mode. And, we're going to be feeling the impacts, and our workers on the front line are going to be feeling the impacts beyond this. So that's a huge piece. I just want to put that out, but thank you all. And I'm so grateful for all that you're doing. I am really, really worried about the state budget situation. We haven't gotten the governor's exact proposal yet, but we know that his approach is to cut. Where I am and where a number of my colleagues are is we have an incredibly inequitable tax system in New York State. We have incredible inequality in New York State. We lead in this country in inequality. That is not something we want to be the lead in. And we should be considering taxing the top 1%, those people who can afford it, to help us address these shortfalls in our budget. It should not be cuts across the board, and we're pushing for that. There've been a lot of bills introduced by me, by my colleagues. Pied-à-terre tax, multimillionaires tax. I introduced a stock buyback tax. We've got a lot of good revenue generators that we could consider that would simultaneously help address the revenue shortfalls, which are real. This is the terrifying thing about a crisis, is that, a slowdown in the economy, causes a reduction in revenues at a time when you need to increase your spending. It's like the absolute worst possible situation. But we can look for alternatives, and we don't have to rely 100% on cuts. And I think that's really, really important. As I see Dan typing in there, real revenue is out there. Yes, real revenue is out there. And we have to, this is a time that demands bold action and leadership. Let's step up and really, pass some of the bills that we've put forward. Is it going to address the entire revenue shortfall? Probably not. You know, I have to, you know, we have to like be realistic about this. And, you know, Congressman Maloney has been an incredible advocate for us here in New York, and not to add to the pressure on him, but we absolutely need another federal relief package.
Yeah. Amen. And Jen, that's what I'm thinking about when you're talking. I mean, first of all, and I have to apologize because I had an hour for this call. I'm already over. I've got a thing with Joe Biden tonight, our next president, and I got to bounce. But first of all, we love you guys, and I love Pat Ryan and Jim Metzger, and they're huge leaders as well. We need more federal help for New York. We need to get the state and local piece done. That is the single biggest thing we're going to do on the revenue. Now, yes, the tax revenue issues that Jen's talking about in New York, that's part of the solution, should have been before the crisis. But this bullshit that Mitch McConnell's talking about, you know, no blue state bailouts, that is a fight we need to have. And we need all of you who have any kind of relationship with the Lee Zeldins or the Elise Stefanik's or the, you know, John Katko's or the Tom Reeds of the world to say now is the time for them, like Pete King, to stick up for New York and say we need that federal revenue here, because that's going to make a huge difference. Our proposal would, on the last round, had we included it, not the first one where we did 150 billion, about 7 billion straight to the state in state and local aid, but in the second round that got dropped because they wouldn't do it, we would have brought $16 billion already back in addition just to the state of New York. And a lot of that would have gone to the counties, and a lot of that would have really gone to folks like Kathy Rodriguez and others who are worried about those county level budgets right now. It would have been 23 million for Orange, 29 million for Orange County, 23 million for Dutchess County, 13 million each for the cities of Newburgh and Poughkeepsie. I mean, real money at the time they need it most. So this fight is really where the action is, in addition to the stuff Jen's talking about. So I got to bounce, but you can count on us to go to the mattresses on this right now in the next couple weeks. This is the whole shoot, Max, folks, and we really need everybody to weigh in with us. I know you're doing a lot. You should know the whole Democratic conference in the Congress yesterday spent 2 hours on the phone with all your international presidents, a bunch of labor folks strategizing on this. It's really, really gonna be the difference between the kind of budget cuts that are being, you know, kicked around right now. People are talking about whether they become real or not. So you guys know this. I mean, you're the leaders. I mean, you're out there already. So thank you for what you're doing. But help us with those Republicans from New York, because if we could get some of them, man, that would help a lot.
Yeah.
But God bless you guys. I got to bounce, but sorry
Thank
to
you
jump.
for your work.
Yeah,
Thank you much, Sean.
I just want to say, I mean, it is absolutely key. I don't see us addressing this problem without that federal relief. It's just not going to happen. So thank you, Sean.
Okay, so at this point,
Can I make one more point? Sorry.
okay.
Only just one more.
We're gonna switch
Okay.
over to
You know, Sean had brought up the county and local governments, but that's a whole different issue that is really going to require a lot of federal funding too. I mean, the revenue generators we're talking about, you know, these at this level, they rely on sales tax and property taxes, and you know, county and local governments provide essential services and are going to need relief as well. So.
And don't forget the state.
Yep.
Well, of course.
Okay, so yeah, I guess Sean is gone already, but we very much appreciate all of his support. We know he's terrific on our behalf in the Congress, and he's going to keep fighting. Okay, at this point, we've sort of trashed our original agenda a little bit because we got the Q&A and then people started responding, and we were going to have a separate thing with the elected people. But it's a great conversation, and I'm really glad we've been having this. At this point, the only person of our elected invitees who hasn't spoken is Pat Ryan from Ulster County. Pat, are you with us?
Hey, good evening, everybody.
Yeah, so I mean, if you have some commentary on what you're looking at for impacts in Ulster County, I have a feeling you may know a few things.
Yeah, and I apologize. I came home to try to tuck my 9-month-old in, and the internet is not the best. So if I lose you all, I've been popping in and out. I'm sorry. And if you hear him screaming in the background, I'm sorry for that also. But it's really good to see everybody. And I know for a lot of us on the line, it's been, if it's like my week, it's been a pretty long, pretty tough week. And it's really nice to see some smiling faces of many I know and many I don't know. So thanks, everybody. I kind of needed this. I know I did anyway. So yeah, I just want to say a few things, and I know we're a little over time and people have to go, but one thing, I've only been the county executive for 9 months, and one of the things that I've realized in this crisis is our county government and so many of our county workers. We have 1,426 county employees in Ulster County, just like Kathy talked about down in Orange County. I mean, we are really on the front line of this thing, along with many of you, but our county workforce that is often underappreciated across a whole host of things. I could tell you 30 stories for hours and hours, but last weekend we stood up our 3rd mobile testing site. Our entire public works crew, all of our public health staff, so many of our team that aren't even doing jobs they're supposed to be doing, were out there throughout the weekend getting this set up to keep people healthy and safe. And just from with the hat on of being, leading that workforce, I'm really proud of what our team has done. That's CSEA members and many other workers doing that work. And I just, I'm glad that other people are finally, a lot of other people are seeing it too. And I just, thank you to our colleagues in Orange County too. Kathy, please pass that on, and all the surrounding area. And then the other piece from my perspective, and Jacqueline, you hit on some of this, and Karen, you hit on some of this in terms of not only is it our county workforce, but we have this whole network, this whole community of, frontline workers, which is the new term, but people that have always been committed to keeping our community safe and keeping them healthy and keeping them well, and ultimately caring, which is what I think is really what's shining through. And so to get to see the work of the nurses and the doctors and the healthcare workers and those in those operations up front, I've never seen that in my previous roles and worlds. And Jackie, I'd love to talk with you about that specific issue because there's a long story there and we're trying to get it fixed. But I know there's been a lot of challenges in Kingston. And Karen, I'd love to hear more about how I could help get you all set up and get I didn't realize there wasn't a contract in place. So I'd love to work with you all on those specific issues. But more broadly, I just please pass on to your teams and your colleagues. Thank you from us. I mean, we were hitting on this, and then I'll stop. Like, it's about to get ugly from a budget perspective. It's already getting really ugly. And my dad used to joke, as I got older, he changed it to shit rolls downhill, but it was other, poop rolls downhill when I was a kid. And it's like everything's in a bad spot, and our county finances are going to be in a really bad situation. And my message to you all is what I really need is your help and your partnership. And you have it from me that this is the moment where we're going to get faced with tough choices. Are we going to take care of workers and protect workers and try to preserve all these jobs and benefits and taking care of people, or are we going to succumb to the pressure? And it's going to take every one of us raising our voices together to not kind of give in to that pressure. So that means, of course, we need federal support. In New York State, just so you know, only 9 out of 62 counties got any federal support in the first CARES Act. There's 53 counties, including all the ones in the Hudson Valley, who got $0 to county governments in that bill. Only the larger counties got it. So that's a problem, and I've been advocating for that. And we're going to need that relief. And I know our Democratic colleagues, Congressman Maloney, Delgado, and senators have been advocating, but as Sean said, it's the Republicans that are holding out on that, and so we need to raise that issue up. But I'll just end by saying that as I've been engaging with our union leaders here, our labor leaders here, the number one priority for me is we keep our people safe. That is the number one thing in every decision that we're making from day one of this crisis when we didn't even know what was going on, and that will continue to do that. And then number two, we're going to keep everybody working and paid. And finally, coming out of this, I think we're, as many alluded to, it's a real lost opportunity if we don't recognize the structural systemic problems that were already broken before this, that are now we're really seeing that are ugly and nasty right in front of our faces in this crisis. If we don't all use this to change, shame on us. And I know that this powerful group of people here can do that. And I would be thrilled to work with you all to do that.
Okay, thank you very much, Pat. So I'm a little confused with what's been going on in the chat. I'm not sure. Minerva, did you want to speak with us? Did you have a question? I'm going to unmute you. Are you with us, Minerva?
Yeah, can you hear me? Hi.
Yes. Hi.
Hi. Oh, I can't show you my face here, right? I don't know how to do that here. Anyway, Pat Ryan already addressed it. Jackie from Health Alliance talked a little bit about the mental health unit at Kingston, and now more than ever, and I think Jackie would be able to address this even better than I, because Jackie, can you just chime in around the mental health concerns that you brought up in Kingston and the services going to Poughkeepsie?
Yeah, so the mental health and detox services that we offered through Health Alliance were through our Marys Avenue campus. We have two campuses, Broadway and Marys Ave. Marys Ave was shut down by directive from the state in case we needed to care for COVID patients, I guess, overflowing from the city or even locally. So that campus is completely on hold, and all the services that we offered there were either ceasing to exist or just moving to other places. So mental health is now in Poughkeepsie at Mid-Hudson Regional. And that is just not good news for all the patients that we serve in Ulster County, not just Ulster County, because we have patients coming from the surrounding counties to us. And now that's even farther for them to go to Poughkeepsie. So there has been no word that we will ever get that back at Marys Ave, because it's supposed to be on hold in case we have a resurgence of COVID and do need it. So it sounds like it's going to be years before we can ever have it at that campus. So I would like to see it at the Broadway campus in the meantime.
And I'll just piggyback from that, Jackie, thank you, because I also represent the techs who currently don't have a contract from St. Mary's Avenue, and it's a huge problem. And I tried to address it on a conference call with management regarding, because how they did that, they didn't even give the workers notice, advance notice. It was like the day before they text them, oh, you got to go to Poughkeepsie for training. Half of these workers don't travel, they don't have a vehicle. So it's causing a huge impact right now when it come on to them traveling from Kingston, because they took a job in Kingston where they live in Kingston. For a couple of them that we talked to, it's like walking distance from where they live to the hospital, and that's the reason why they sign up to do the job. Now they move it across the Mid-Hudson Bridge over into Poughkeepsie, and we also represent our members over there in Mid-Hudson Regional. And it's like they just dump these workers over there, and they're saying, I tried to get clarity, and I said, so when is this going to come to some resolution? And they were very candid and saying they can't answer, they don't know. And I'm like, but the plan was that if you got to insurge, that you'll be using that campus. Now it's not being utilized. What is the plan for that? And they would not say. So I don't have, from what I'm hearing over in Poughkeepsie, they don't intend to move back the service over there. They plan to keep it because they have opened up a dedicated unit now in Mid-Hudson to host these patients. And they are keeping the detox and the rehab and the mental unit over there in Poughkeepsie. That's what I know from our end. So I'm looking forward to work with you and Mr. Ryan on this, because again, it's a huge disservice to the members, to the community in Kingston. And they just can't just, arbitrarily do that. I don't have a contract there for the workers. Unfortunately, they just organized. And right after they organized, we were getting together to start doing proposals. The crisis came around, so it stopped bargaining. So that's the huge problem that we're faced with, and the workers are scared that they can't refuse. They have to go because this is their living, and they will get fired or terminated if they don't show up to these places to work.
And also those workers are not getting compensated for the extra mileage, the tolls,
No,
anything.
No compensation at all, none.
This is Jeanette from PEF, and to thank my brothers and sisters who remember the big fight we did with OMH for our crisis mobile unit in Orange County. Unfortunately, OMH also closed their crisis mental health unit up in Sullivan County a few years ago, and it kind of went under the radar. So those crisis mental health units that are going into our urban cities, made up of a clinical team, are being cut. Also, our Office of Alcohol and Substance Abuse, known as OASIS, they are under significant cuts. And now when we're going to see, unfortunately, I hope not, but we're all seeing an uptick in alcohol, substance abuse, and other items, OASIS is also cut to the bare bones. So we had one small win in Middletown, and I know Kathy Rodriguez and a lot of our CSCA folks joined us when we were meeting with the legislature, but at the same time, the OMH crisis unit, the suicide hotline, all of those actions were diminished in Sullivan County. And now is the time that we need those services more than ever. It's bad enough that we're losing our members and our loved ones and those we serve to this unprecedented COVID-19. It's just even a greater shame when we see the residual impacts and we start losing those we love, those residual impacts.
Jeanette, when did you say those cuts were made in Sullivan?
They cut up there, they cut the crisis unit mobile team, I'm going to say about 2 years ago. And then, well, maybe 3. And then we had the major fight at Orange County to sustain the OMH satellite at Orange County, which does a tremendous job. They're a very skilled clinical team from everywhere from a nurse practitioner, and they are going into the homes of individuals in crisis and doing hands-on treatment in residential settings and other places. So it's unlike any other team, they're called like the ACT team. And when I say that they activate, they're beyond. But Sullivan County was already cut. But OASIS is a big concern for us. Because they do all the trainings and provide assistance and guidance, our state agencies, even to the voluntaries or the private sector who are running nonprofits, doing similar type of work, but the state provides the overall guidance, and I'm very concerned to see those cuts. Yeah. And they're going to be looming. And I just don't think we can afford, again, one death is one death too many, and I know everyone on this call has probably suffered something. So my heart goes out to you. And one more death that's non-COVID related, but an impact of COVID, we really need to make sure that we're providing supports.
Yeah, no, absolutely. The services to address substance use disorder are more important than ever. And as you know, in our region, we've got among the highest death rates in the state, opioid related death rates. And I mean, these are going into this this round of whatever it is with the budget, let's call it a re-examination of the budget. We're going to be, we have got to push to prevent these cuts to these services that we desperately need at this time. I mean, we have to, but it's going to be an act of magic if we don't, consider other revenue sources, or and I should say to get another round of federal relief, because the facts are that the budget has to balance. So if the money is not there, we can't spend it. So we've got to get those funds. It's a desperate situation.
Okay, so I understand.
I'm sorry, just so you know, Jen, you know the magic word. Medicaid, CMS.
Yeah, no, absolutely. We are fought like hell to at least, to prevent the cuts that had been proposed, but there were still cuts that were terrible at a time in a public health pandemic, you know, I mean.
Okay, if I could ask Pat Ryan, I think had one last comment. Pat?
Yeah, thanks, Beth. Yeah, and I do want to say on Medicaid, both Jen and I have been scheming on that and working on that for a while, and we're going to keep fighting on that. I just wanted to make sure I addressed, because Minerva, you brought this up, and Jackie and Karen, and I think Daniel in the comments too on the mental health unit. I would love to not take everybody's time now, but if we could set up another Zoom or call or whatever we can do in these weird times we're in, I would really like to get this fixed, because I share the same concern. I've been asking the same questions. I can tell you I am not going to let really many more days go by with no mental health in my county. And if the state can't get us an answer on this, then we got to escalate it. And I think all of us working together, we could do that. So I'd love to just maybe somebody on the line, maybe who has all of our mutual numbers, can help us connect in the next few days. That would be great. And Sandy, thank you.
Okay, Sparrow, you were going to say a few words?
I'd just like to thank everybody before we move on to the wrap up. Great job. And I'd like to thank our elected officials that stopped in. You know, when we were thinking about it, Sandy and I, the director and the committee, education committee, that's an outreach that's putting on these forums, we thought who would be the best to speak about the pandemic, and you know, 3 politicians, elected officials, jumped right to the top. You guys are doing a great job with this crisis, and you know, Pat Ryan, Senator Metzger, and Maloney have been top notch in the Hudson Valley. You know, really taking this crisis head on. So we can't thank you enough, and we wanted to recognize the hard work that you guys have been doing. So thank you very much. And a big shout out to Senator Metzger for showing up to the picket line today for the local 445. We appreciate it. Back to you, Beth.
Okay, so a quick wrap up here, because we're running over, but I think it was a really rich conversation. I mean, I'm just pulling a few like basic takeaways from this that I'm hoping we can all continue to work on together as we move forward. Number 1 demand, I think, is respect for all our workers, okay, especially those who are now all of a sudden considered essential. But you know what? Workers are essential, period. So respect. Federal and state funding, that takes a big, we need that. Right? In order to fight against job losses, the kind of cuts that we all are sort of fearing and seeing coming down the pike. So we want to ensure as much job security as we can and resist cuts to jobs for people, right? We want to improve our working conditions out of all of this, recognizing the kind of radical inequities of our system that this COVID crisis has exposed. And then ultimately we want to make sure that we have safe workplaces, so that we have, you know, all the PPE provided that we need, that we have sufficient staffing to do the jobs that we all need to do, have things like paid sick days ensured for everybody. And I think we also need to really think long and hard about rights of people to resist going back to work prematurely, because this is coming up in other areas of the country. There may be places where certain employers or whoever are kind of pressing people to come back, and especially if somebody's got, you know, if they're immunocompromised or they live with somebody who's immunocompromised or elderly, and they don't want to put themselves back in a work situation which would involve them endangering their loved ones. People need to have a right to resist that kind of demand. So that's just sort of a short list of a few of the ideas we have. I'm going to do, at this moment, I'm going to launch a poll in the Zoom window. And what we're asking here, we're intending on making a series out of this. We're calling it initially sort of First Fridays for Labor or something. And so we were wondering about what topics y'all would be interested in having us address as we move forward. The next First Friday would be June 5th. So we're going to try and organize another one of these kind of conversations for June 5th. So anybody, I mean, it's multiple choice. You're allowed to pick more than one topic. So please, if you're on the call and you're on the Zoom and you want to just pick, give us some feedback, tell us what topics you're interested in doing. And I'm looking forward to continuing organizing these things. We're going to have, I hope, some kind of follow-up. The Education Committee will get back together and kind of write up and summarize what we did tonight and get that back out to everybody. And we'll just keep building it. So thanks to all of our panelists, all of your great experience, all of our electeds who came along. I mean, everybody who attended. Thank you, thank you, thank you, everybody. We love you.